So IC Impacts is a pan-Canada, Canada-India Research Center of Excellence working on in the area of infrastructure, health, and water. And UBC Future Waters is an excellence cluster at UBC, which focuses on interdisciplinary research at the intersection of law, policy, and governance. So this is the organizing committee of WESTalks. It's basically Abhishek, who's a PhD candidate at UBC, Layli, who's a postdoctoral researcher at UBC, Carl and myself, and Jaskuran, who's from University of Gulf, and Feria, who is the representative from the IC Impacts committee. So it's been a wonderful series. Even this term, we have had a lot of wonderful talks. And today we have Dr. Kerry Black from the University of Calgary, who will be giving a talk on the tip of the iceberg, water health, and the governing divide in Canadian Indigenous communities. So this is just a screenshot of our global outreach and the number of people we have been able to reach out through WESTalks. And as you can see, we have pretty much covered a lot of countries in the world. And we keep growing as we keep moving forward. So thanks again for all your support. Just to let you all know that all our talks are available on the IC Impacts website. So in case you have missed a talk or you want to go back and listen to any of our talks, they are available on the website. So please go and have a look. And with that, I'll introduce today's speaker, Dr. Kerry Black. So Dr. Kerry Black is an assistant professor and Canada Research Chair in the Center of Environmental Engineering Research and Education at the Department of Civil Engineering at the University of Calgary. Her research focus is on engaging in a cross-disciplinary research program, incorporating technical, civil, and environmental engineering principles with policy and socio-economic components. She majorly focuses on sustainable infrastructure for healthy and resilient communities. Over the past 12 years, she has worked extensively in the academic, public, private, and nonprofit sectors, employed in technical, scientific, policy, and management roles. The majority of her experience has including working with and for Indigenous communities on urgent and pressing infrastructure issues across Canada. Her cross-disciplinary research has been featured in both engineering and social science journals. Dr. Black is a strong advocate for increasing diversity in science and engineering, sustainability initiatives and programs, and community development, including her work with the Indigenous communities. With that, I would like to welcome Dr. Black. Please, you may share your screen now.
Thanks for that. Always remember to unmute. You would think a year later we'd remember to unmute, but still catches me every time. Okay, I'm going to share my screen. 1 second here. Okay, so thanks for joining today. I know we have no shortage of webinar options, it seems, in the world today. So thanks for joining this one. Much appreciated and taking the time to sit on Zoom for yet another discussion. I think, let me just hang on here because it's giving me a little note that, can you see that? Okay, awesome. So what we're going to talk about today is what I'm calling the tip of the iceberg, which is with respect to water health and the growing divide in Canadian Indigenous communities. For some of you, this won't be new information. For some of you, it might be new information. For those of you who have kept up to date on this topic in particular, you might be surprised at exactly how big the water crisis in Indigenous communities in Canada is. So we're going to talk a little bit about what you know versus what's hidden beneath, and how we might approach that differently by re-engineering our process and not necessarily focusing just on the technologies. So what I want to do first is to acknowledge where you are all located and where I am located. So in the spirit of respect, reciprocity, and truth, I honor and acknowledge the traditional territory of Treaty 7 and the oral practices of the Blackfoot Confederacy. The Blackfoot Confederacy comprises the Siksika, the Kainai, and the Piikani, along with the Yahi Nakota or the Stoney Nakota and the Tsuut'ina nations. I want to acknowledge that this territory is also home to the Métis Nation of Alberta Region 3 and the historic sort of Northwest Métis homeland. And I acknowledge all nations, Indigenous and non-Indigenous, that share the space that I am. Wherever you're located today, many of you might be located on our west coast in Musqueam, Tsleil-Waututh, and Coast Salish Nation, or you might be located somewhere else. Wherever you are, I acknowledge the territory that brings us together and allows us to engage in a space of collaboration, whether that's in person or what we're doing now, which is virtually. I also want to acknowledge today that I am a little bit off my A game, and that is because yesterday we lost a colleague and friend and mentor, Dr. David Lertzman. Very suddenly and unexpectedly, we were scheduled to give a presentation together yesterday on something that we've been working on for a while. He has been a tireless advocate for Indigenous peoples, reconciliation, and decolonizing our thinking. As a non-Indigenous ally, he was quite an important mentor since I started at the University of Calgary 2 years ago. So I just want to acknowledge that if I'm not at my A game, you'll have to just be kind and patient with me. But I just want to acknowledge the important work that David has done, especially within the Treaty 7 context. So let me start by giving you a little bit of perspective of who I am, because that 100% shapes the kind of conversation we're going to have today. So I'm trained as a civil engineer, an environmental engineer. I'm a researcher, but I use that term not loosely, but differently depending on who I'm talking to. Everything that I try and do is community driven, but it's health focused, and it's recognizing that as engineers, we have a very important responsibility to protecting public health, especially as civil engineers. And so that drives my approach to engineering. But I will warn you that I take a non-traditional focus to the way in which I tackle engineering problems. And it's the assumption that we need non-technical interventions and solutions to inherently technical problems. And so that comes in the form of policies and decision-making and stakeholder engagement in really understanding the bookends of the technology development process. So if you spend most of your time in the technology piece, that is a very important place to focus. But equally as important are the bookends of that, which is one, the context under which you are developing that technology, for who, why, what purpose. And then the other bookend of that is being able to mobilize and translate that knowledge in a way that's accessible for people that actually results in measurable solutions. So that's the approach that I take, and that is really going to shape the way that I'm going to talk about this topic today. Because I will be focusing on some of the what is deemed less technical topics. So obviously water, there's no shortage of people who get fired up around this topic, whether it's access to water, safety. Around the world, people are having difficulty in accessing safe, clean drinking water. It is an ongoing problem. It tends to be, in a Canadian context, one that we feel a little bit more detached from, and that's because no matter where you live in this beautiful country, you can drive 15 minutes and probably find a body of water of some kind. And so that water scarcity, water quantity issues don't ring true to many of us. But we have a lot of issues in our very own country that we'll begin to address. But I think it's important to understand that water is sort of a topic that unifies many of us, because lack of water is something that impacts us in far-reaching ways than just not being able to drink enough clean water every day. So whether it's disease, whether it's access to other economic development opportunities, whether it's civil unrest, there's all sorts of ways in which we're impacted. And this is just becoming more and more of a problem as climate change impacts continue to deteriorate our water resources, as we continue to discharge into our bodies of water and the quality that is impacting those downstream from us. But let's pause for a second and recognize that in 2013, Canada was ranked 4th in terms of, now there's lots of different reports, as many of you know. You can read whatever you report and hope that you find something that you will agree with. But this came out in 2013 that ranked Canada as 4th overall in terms of our water quality. That was a report that came out almost 10 years ago, and Canadians generally identify with that. If you ask Canadians, how do you feel about the quality and state of your drinking water or water in general, they would say that they felt they ranked pretty high. We have very pristine water sources, and many people enjoy recreationally the water that's at their disposal. But it's changed a little bit over the past 7 to 8 years. We've dropped down the ranking depending on what you're looking at, and this ranking of 13th is actually quite a high ranking, because what we'll look at now is the most recent report, and this is from the Environmental Performance Index, which comes out of Yale. And Environmental Performance Index indicators provide a way spotting problems, identifying trends, understanding where we might be able to adjust policies to better protect any areas. And there's a whole slew of areas that they focus on. And I'm just covering here two in particular that I would want to draw your attention to. That is our ranking on sanitation and drinking water, and our ranking on water resources with respect to water treatment. You can go online and read about the EPI indicators. They are useful in also addressing the UN Sustainable Development Goals, which have a strong focus on water and water protection and wastewater and sanitation. But when we look at a Canadian context in particular, you're going to see the ranking right there on the right-hand side for sanitation and drinking water has fallen quite below. So we are behind the ball when it comes to our ranking for drinking water and sanitation, and also wastewater treatment. Why is this the case?
Kerry, sorry, I might just stop you. We're still just in the first slide that says treaty setting.
Oh,
I'm not
really?
Sure. I hope we didn't miss too much.
Carl, you missed the whole presentation, and
Yeah.
I have to start again and start rambling. Can you see it now?
Yeah, we're looking at a table now.
Okay, hang on, because it's, I'm gonna stop for a second.
Yeah, sure. I don't know if there was many slides in between that, but we saw
There was 55 and you've missed them all.
Yeah, that's perfect. Okay, great. I'll read it up after.
Don't worry. Carl, a year into teaching online, nothing surprises me. You can have a presentation every bloody day, and the next day something will go horribly wrong. Let's bring it up and again in a second. Okay. Sometimes. Is it changing for you? No way.
We're looking at civil engineer, researcher.
That's really weird. Okay, hang on.
You can leave it in this view if that's easier.
You know, Carl, I just did a presentation an hour before this and it was totally fine. But it's saying it's paused. I'm going to stop sharing for a second. Let's give it a second here and let me restart it. In the interim, you just listen to me ramble with no exciting slides. I'm going to blame technology today. But it's okay because I talk fast anyway, so I'll make up the time in no time. Okay,
I always think that's a good idea to just talk faster, and it never works.
I already talk crazy fast. Okay, let's try this again. I don't know why that would be. If it doesn't work, we'll just keep it open in presenter mode, and everyone will forgive me for that. No, it's still doing it. Okay, let's keep it like this. I don't know why it's doing that, since I just did it about 30 seconds ago. We're gonna keep it like that and forgive the technology. So here's where we were at, and here's the slides that we missed. And I'll go to this slide. Everyone can see that now, Carl?
Yep, looks good. I think that the title is cut off, but it's, we're just missing. There we go. Yeah, perfect.
No stress. No idea why it's doing that. Somebody call Apple and just complain to them about it. Okay, so here's where we're at. The ranking on the right-hand side there for drinking water and sanitation and wastewater or water resources. So 22nd for drinking water, 31 for sanitation, wastewater treatment at 28. So overall, we're doing okay, but we're struggling a little bit. And a big reason that we see those numbers drop down a bit is because of the inadequate or inequities that exist between access to safe drinking water within Indigenous communities and outside of Indigenous communities, but also the rural and urban divide that we have. We are a huge country with a massive land expanse. So as soon as you get out of urban centers, we struggle with reliable water quality, especially as you enter into our more northern locations and also in through the prairies, where we struggle with water quality. So let's pause for a second as well. Now that we know, where Canada ranks in that, let's talk a little bit about what exactly is considered, sustainable clean water. And so here are some words that come up when you look at the United Nations definition of what accessible, sufficient water is. And you'll see these words: affordable, accessible, sufficient, safe. And so those are all words that we use to define by the United Nations what is adequate access to clean drinking water. And if you look at them closely, you can see that they sort of fall into or lumped into a few different categories. affordable and accessible land use pretty much around accessibility. So is it accessible from a physical geography perspective? And is it accessible from a cost-based perspective? That's one way of doing it. The other one is sufficient. Sufficient really relates to quantity, and acceptable and safe really relating to quality. It's not just the United Nations that identifies this in their right to water. So the universal recognized right to water identifies that that right means that you have affordable, accessible, sufficient, acceptable, and safe drinking water. And then they go further on and define those as well. Also, the World Medical Association recognizes that an adequate supply of clean drinking water is essential for individual and public health perspectives, as also being, and this is important, a social determinant of health. And we'll come back to the social determinant of health piece. But it also constitutes what is considered central to giving a life in dignity and health and upholding human rights. When we talk about sufficiency, we're talking about water supply for each person that is sufficient and continuous for not just for personal use, so not just necessarily what you're using to drink, but it's also about what you use domestically to clean. So not just yourself, but clean the individuals living in your home, actually just cleaning your house. So what is the water in terms of quantity that's required? And this is a very slightly controversial discussion, because this is often defined in a world global scale, and often defined by what is the minimum requirement that you need in a developing country. And where that gets a little bit muddied is that that's what's used in a Canadian context for those communities that don't have access to safe, clean drinking water. Quantity or sufficiency defined globally generally lands you anywhere from 15 to 30 liters per day. That is meant to cover all of the uses that you might have at it. The average Canadian uses 300 liters per day. So we have a disconnect there. The second piece to this is quality. So at the bottom left, acceptable and safe. So water needs to be safe. So it's free of microorganisms, chemicals, radiological hazards, which we have threats in some of our areas of Canada. And it also obviously needs to meet our Canadian drinking water quality guidelines. It also needs to be acceptable in terms of not just those microbiological concerns, but also things like color and odor and taste, so that people actually want to drink it or want to use it. The last piece at the top left there on affordable and accessible, again, physically accessible in a Canadian context also gets really complicated, because from our topography and our large land expanse means that it is difficult at times to access reliable sources of clean drinking water. And then affordable, I think, is one that's self-explanatory. Canadians pay relatively little for their drinking water. The same can be said actually, not just for domestic users, but also industrial users. We don't pay very much for the water that we're using, and that helps to breed this perception that we have an abundance. And so within this conversation and talking about where we stand as Canadians around access to drinking water, let's talk a little bit about why this is different for Indigenous communities. And in order to do that, one, I want to clarify, I myself am not Indigenous. I do not speak on behalf of or for any Indigenous communities. I have spent most of my professional career working with Indigenous communities, but I am a white, settler, and privileged individual who has never struggled with access to clean, safe drinking water. It's important that I make that distinction. But I do think it's important that those engaging in this conversation understand the true situation of what's faced by our Indigenous communities. And the first place to start is to understand that our Indigenous communities in Canada have a very unique context, and that context is one that we don't often integrate into our design process. So the context is that they have a unique historical, political, social, economic, and geographic considerations that makes the situation different. We also have policies that are very different in Indigenous communities than they are in non. And that's because Indigenous communities through the Indian Act are regulated or governed or have policies that are driven from a federal perspective, federal government. Everything else that we talk about in our municipalities tend to be driven by the municipal and provincial government. And the feds provide sort of an overview of where things should be at, but they're not enforcing that. That's not the same in Indigenous communities. So those policies are from the federal government, and they have historically been very top-down colonial processes that disconnect Indigenous communities from that process. Since about 2016, we've seen a push towards more integrated approaches, collaborative approaches, ones that bring people together, that draw on local experience and knowledge, and that are Indigenous led, but we still have a long way to go. So building on that, water and First Nations in particular. So to clarify, Indigenous communities in Canada comprise Inuit, Métis, and First Nations. I'm going to speak particularly about the situation with First Nations. That's where my experience lies, but also it's a very different context in our Inuit communities in the north. And then with Métis, depending on whether or not there's a land base or reserve system for that, changes the conversation. So again, the federal government having a strong role, the provincial government tends not to have a very prominent role, and by right is not supposed to have a role. And then there's involvement of both Indigenous communities and their leadership, as well as a lot of technical services organizations, consultancies, etc., individuals that play a part in this conversation. Largely speaking, though, they have higher rates of overcrowded housing, poor access to drinking water. They are impacted by inadequate access to healthcare, to internet and telecommunications, to education. They have higher rates of disease, higher rates of employment, incarceration, and suicide. I'm not throwing this at you to make it sound really depressing, but it is actually very depressing. And take a snapshot of what's on your screen right now and think about this in the context of what the reality that we're all living through right now in this past year. So we're trying to mitigate and minimize the spread of COVID-19 in communities that have individuals with higher rates of disease and comorbidities, in communities where we have individuals who are in overcrowded housing, in communities who have poor access to sufficient drinking water to do the very thing that we've said to individuals we need to do to stay safe, which is to wash your hands. And then we're also in communities who have forced them to go online for things like education, in areas where they already struggle with access to adequate education, and in areas where we have issues with internet and telecommunications. So take this inequity and then put it under a microscope, because that is basically what COVID has done. It has really ballooned the impact in Indigenous communities in particular. So one of the take homes is that we could have had this conversation a year ago and it would have been bad. But a year later, after COVID, the situation is far greater and far worse than I think we actually realize. Let's talk for a second about how what the situation really is. And drinking water advisories are the one way that people tend to monitor and talk about this conversation. And in a Canadian context, drinking water advisories are issued by a chief and council at the recommendation of the government. And then you basically issue one of three types: a boil water, a do not consume, and a do not use. A boil water advisory is in most First Nations communities, 98% of the drinking water advisories that you'll see. In very, very rare circumstances, you'll see a do not consume or do not use. And all of you, I think, can determine what would be the factor that would make it shift away from a boil water advisory. So basically anything that can't be removed in a boil water process is what would render it a do not consume or do not use. So that is the way that we report about it. If you go on the news and Google it, you'll see no shortage of pieces talking around drinking water advisories. And we'll talk a little bit about those in particular, and then we'll talk a little bit about why maybe that's not the most important factor to consider. So let's take a look at one community in particular that made the news in December for the second time because they were evacuated. So in the middle of an COVID-19 outbreak, the Skandiga had been evacuated. They're located near the Ring of Fire in Northern Ontario. They've been on an advisory for 9,589 days, a boil water advisory for over almost 25 years. Put that into context. Some of you on the line may have been either not born or just born. Think about whether or not what you would do if you had been on a boil water advisory for the duration of your life. Now, a lot of people say, well, it's just a boil water advisory. That's just the water that they're drinking. But ask yourself, and especially those who may have kids or young siblings or cousins, whether or not you'd feel comfortable bathing your children in water that is not fit to drink. Anybody with a child who's ever put them in the bath knows that pretty much all they do in the bath is drink that water. And so many people in the Skandiga have spent their whole life and have never had a shower or a bath because of the quality of their drinking water. So they've gone their whole life with a mistrust of their drinking water, and for good reason. So take pause with that one. Ibamatun, not too far from the Skandiga, actually basically their neighbor. 7,217 days on a drinking water advisory. Think about the length of time, what that means if you've been on a drinking water advisory for that period of time, and ask yourself for a minute, and we'll get to it, why you think that's the case. What is really the issue here? Nishkanaga started in 1995, and Iramatoon was 2001. So we're talking decades and decades of experiences. Let's shift a little bit again. So some that aren't captured by the current focus of the federal government around drinking water advisories are communities like Quechuan. In 2005, 5 years after Walkerton, and for those of you who are not familiar with Walkerton, a quick Google search will tell you the crisis that existed in Walkerton, the number of deaths, and people that got sick from contaminated drinking water. Quechuan actually in Northern Ontario, another Northern Ontario First Nation, had been on a boil water advisories already for 2 years when their residents were ordered to leave due to high levels of E. coli. This came out after the Walkerton report, and we'll talk about that one in a second, that said that First Nations water or access to water was an extremely urgent issue that needed to be addressed. So 5 years after Walkerton, we made pretty big changes in our Canadian policies around protecting source water and ensuring that we have compliance on drinking water treatment, but we didn't do the same in First Nations. Take another example, Attawapiskat has been on and off long-term drinking water advisories for 2 decades, including several states of emergency, several evacuations that have been covered all over the media. There's also communities like Shoal Lake 40. Here's another example, and this one is one that, that really gets to me in particular. Grassy Narrows, they had mercury contamination for over 50 years. 90% of the people living in Grassy Narrows are exhibiting right now, today, symptoms of mercury poisoning, and we're only just beginning to address that issue. So it's a big issue, it's a big problem. Another community, Pekanjikam, now many of these are in Ontario, which happens to be where there are the largest number of long-term drinking water advisories. Pekanjikam in 2001 was identified as a community that was at risk. They had over 400 homes that weren't being accessed by water, by piped water systems, and they had requested funding to fix that. It was denied, and they had been on and off drinking water advisories since then, including a major long-term one that was lifted in 2018. So you have a huge number of Canadian Indigenous communities who have no trust in our water system, who've been on drinking water advisories for a really extended period of time, which forces you to ask the question, what's really the problem, right? So is the problem that we don't know how to treat water correctly? And I think we can all agree that we know how to treat water. The rest of us have pretty decent, reliable supply to clean drinking water. Not to say that interventions aren't needed as more and more new chemicals enter our systems. We need advanced treatment technologies that can deal with some of the contaminants entering our system. But straight up, just plain old conventional drinking water treatment, we've had that in the bag for a century, right? So what is the real issue? Is it technology and design, or is it maybe something in context or implementation? Keep that in the back of your mind, because let's keep talking a little bit about the drinking water advisory piece and where we're really at. This is still, again, we're only talking about the tip of the iceberg that you actually see. These are all documented cases that are reported on that people know about. In 2001, they did an assessment of the state of water and wastewater in First Nations in Canada. They deemed that 75% were either medium or high risk. 10 years later, they did the same assessment, and 74% were deemed high or medium risk. We haven't had a fulsome analysis since 2011, but you can venture to guess on a risk scale, we are likely very near to that level. Let's take a look at a few snapshots in time, because many people will say, well, Indigenous communities aren't the only ones that are on drinking water advisories. Non-Indigenous communities are as well, and that's true. But generally speaking, non-Indigenous communities tend to be on those drinking water advisories for a lot longer than non-Indigenous communities. So this is a snapshot in time from 5 years ago. So for the most part, you can actually add 5 years to each of these categories because you'll see it lands around the same piece. The majority of communities have been on advisories for at least 5 years. That's 5 years of sustained boil water advisory status. That's an incredibly long period of time. If you think about it from an urban context in Canada, if you are doing repairs on a water main and you need to shut down the water for 2 hours, you're probably going to get fired because people are going to get really upset. Nothing bothers people more than being inconvenienced, like not having access to be able to turn on the tap. Put 5 years on that and see where the state of affairs are. And it's important to put that context into perspective, because when you read about it in the media, you detach yourself from it. You think, oh, well, they just need a water treatment plant. Oh, it's not that big of a deal. Think about it though. Think about the inconvenience you feel when one thing goes wrong in your household with respect to water. How much of an inconvenience is it? Let's take a look at, I picked a series of years at random from 2015 to 2016. Here's the change over time, nothing really changing. Now, starting after 2016, you'll see this start to go down a little bit, but it's a little bit of a misleading chart. You see it start to go down. However, what's also happening is that the federal government is also devolving some of this responsibility to regional entities. So when you go and you see that there's only right now 31 long-term advisories still in place, or 33 or 51, depending on what you're reading, what you have to remember is that's not the full picture. That is only the tip of the iceberg. And we'll come back to that again. Here's what you're seeing, generally speaking, over time. They've either increased. Now this has started to come down a little bit and landed around the same level as 2006 levels. These numbers also don't show the whole picture, and we'll talk about why that is in a second. Here's something to think about what the causes of these drinking water advisories are. And this is from 2014, same distribution in 2006, same distribution in 2020. So we have issues with source water, issues with equipment malfunctions, issues with disinfection. In fact, at times no disinfection being in place. We have concerns about the quality of water that's coming out. We have turbidity issues, operational issues, and all sorts of other pieces that are contributing to these drinking water advisories. So that's why we land that what we actually know about is just this little piece up here. And what we don't know about is down here. And let's talk a little bit about why that is. Number one is that what's reported in the media is only those advisories on centralized distribution systems that have 5 connections or more, and that are federally funded by the federal government. So that's a small portion. It also doesn't include typically the numbers in British Columbia, which are reported by the First Nations Health Authority. Also doesn't include the Saskatoon Tribal Council, some of our northern nations, and some pockets within the rest of Canada. So it's a very, very small number, but it's a focus of the media. But it's a bit of a misguided focus because we have this whole other issue. And that whole other issue is the difficulty in centralized and decentralized systems. So a huge number of Indigenous communities are on decentralized systems, individual wells and cisterns and septics for their water and wastewater. Part of that is because of their geographic location. Part of that is funding related. Part of that is our policies that have dictated when and how centralized distribution networks can be installed and funded. And so you have a huge number of decentralized systems. I'll give you an example. One of the communities that I work with in Treaty 6 in central Alberta has 130 advisories in place in their community. And those are on their individual systems. So 130 in one community in central Alberta. That's 130 individual homes that can't access reliable, clean drinking water and who also aren't on a distribution system. So what do you do in that case? When no one knows about it, no one really cares about it, there's no funding to actually support renovating, replacing, and putting them on a distribution network. How do you address those issues when you've got a problem that is not well understood and is not well funded? The decentralized issue for First Nations and Indigenous communities in Canada is the #1 issue that we are facing with communities, and it's not well understood and it's not well funded. Now, a lot of people have shifted their attention, engineers have shifted their attention to technical interventions. So point of use systems. Well, if you've got a poor well with poor water quality, let's fix something on the end of your tap so that we can make it clean. Does that work? Sometimes it does. Are they the most cost effective? Not always. Are they what communities want? More importantly, not necessarily. And that's because communities in Canada, Indigenous communities, generally speaking, want parity. They want to have water within their communities that is of equal sufficiency in terms of quantity and quality and accessibility as non-Indigenous communities. And that's really what the plea is for. But this decentralized piece, every time you read something in the news media, take a step back and multiply it by a huge factor, because that will be the real issue facing Indigenous communities with respect to water. So why is that the case? We've talked a little bit about why that's the case, but from an engineering perspective, our approach has been very one size fits all. It's here's your water treatment plant, and then you leave and hope that things work out for the best. Now we've started to change that a bit, but not necessarily. There's also a real preference to trial and pilot really new innovative technologies in Indigenous communities. You tend to see more of that in Indigenous communities than non. You also tend to see treatment unit processes that are the Cadillacs of water treatment that you will not find in non-Indigenous communities. There's really great examples across the prairies of drinking water treatment systems that have reverse osmosis and biological treatment and filtration, all wrapped into this super mega treatment process, which is very interesting, but it's very costly. And it's something that you will not see in a non-Indigenous community setting. So that's also should make you ask some questions. Generally speaking, our design process doesn't account for context, the unique context of Indigenous communities. And it doesn't, it's not always relevant. It's not always the solution that communities wanted to come to. We have an extremely slow, sluggish approval process, and that's because it's limited by this federal bureaucratic process. We also have a process that's driven largely by non-Indigenous people who come into this space of working with Indigenous people, but don't have the right training and context to better understand that. So we have outsider people coming in, driving a process. And for that reason, we have very little community input, involvement, or direction. Anyone who's worked for an engineering consultant knows that there's this public information period where you can go to the public and share what you're designing or proposing. Those tend to be, unless it's something really controversial, very poorly attended events where poor engineering consulting companies standing in the front of the room, rambling on about something, and no one really cares about what they're talking about. In Indigenous community context, we didn't change our process. So when no one came, we just thought, well, no one cares about it. We'll just put this treatment plant in anyways. Not the case. We actually didn't approach that in community involvement process in the right way. When we talk about the federal piece, it's important to utilize words like colonial, because that is what has driven the process. They are colonial, top-down, disconnected from community processes. And so we're dictating to rather than engaging with Indigenous communities. We also have failed to learn from our work in an international development context. It used to be that you would go to a developing country, install a well, leave, and think that you were the savior of that community for providing them clean drinking water. That changed because we would used to go back a year later and go, wow, no one's using this well. And it's because we didn't offer training and capacity. We didn't think about long-term operation of the well. We also didn't understand unique relationships with water in that community. We haven't learned that same piece in a Canadian context with our Indigenous community. So we still think, here's your water treatment plant. Here's what's going to solve your water issues, without thinking about training, capacity, education, long-term operation. And then the chronic underfunding piece. And that's something that is really important in this context. When you think about what solution you're going to provide for Indigenous communities around water and wastewater, funding is huge. But the funding gap is very different in Indigenous communities than non. You got a few factors. On the left-hand side, you have no funding at all, which has resulted in some communities having 0 water treatment plants, or 0 distribution networks, or 0 wastewater treatment plants. So throwing money at in terms of operation and maintenance funding towards something that doesn't exist, not very helpful. So you actually have to infuse a huge amount of capital dollars to actually build those structures at the outset. And then you also have to think about the middle piece. The middle piece is that we've not actually funded the operations and maintenance adequately. If capital costs are around 25%, if that's all we're budgeting for or factoring in, you've got to come up with, at a community level, a huge ton of money. And the federal government provides funding for it, but it's not sufficient to address the operations and maintenance. So that whole time period when you had, let's say a community had a water treatment plant installed 10 years ago, without sufficient operations and maintenance funding over the past 10 years, the money I now require now to fix, renovate, and repair is more than double what it would have been if I just infused that money all along the process. Same applies in any sort of asset management approach. You don't invest the money annually to maintenance. By the time it comes to repair and renovation, you're paying 2-fold, 3-fold what you would have paid throughout the maintenance process. And the last piece is that Indigenous communities are growing at in terms of population at rates that far exceed non-Indigenous populations. So the funding required to build new water treatment plants, to renovate those water treatment plants, which have been also under-designed. So they haven't been over-designed in the same way that they should have accounted for the unique population. So in the last few slides, I'm just gonna quickly talk about a couple things here. And this is to go back to the point earlier around 2001. We identified this as a problem in 2001. 20 years later, what has actually changed or moved this forward? We still have the same issues that were identified in that 2001 report. Access to obsolete, inadequate infrastructure, operators and inadequate inspection processes, issues with contamination, distribution and sometimes no distribution, equipment malfunctions, and that's a direct result of no operations and maintenance funding, sometimes no treatment in place, issues with microbiological contamination, and lack of adequate testing to really understand where we're at. But it's also that we don't really fully understand just how big the water crisis is. So it brings me back to the question again of whether technology is the problem. And I'm not here to say that it's not a help. Technology is definitely going to help in this process. But if it's developed in isolation, separate from community, separate from social pieces, and this applies not just in Indigenous communities. When you develop a new technology, it doesn't matter if nobody wants to implement it. So why do we put solar panels on our, on our roofs? It's not because someone invented it and we just put it right on. It's because someone was able to make us understand the value and the benefit of doing something like that. So we actually need to do more outside of the technical development sphere to adequately integrate social elements into our design process. But it's not something we actually teach our engineers very well. It's not something that we actually teach each other very well. And so we need to shift our approach. We have to understand context more. We need to move away from top-down approaches that are disconnected. And we need to figure out how to really incorporate context into our design approach. And so we'll move away because we'll understand the vulnerability of having a technology-focused approach. We'll move away from a very monoculture of environmental management and infrastructure design. And what I mean by that is it tends to be that if you go to a certain community and you look at the water treatment plant, you know exactly who built it, when, what company, because they're just picked up module-based and plotted into a community, right? That's not necessarily the most engaging way to come up with a holistic solution to water and wastewater for communities. And that brings us to the point of whether or not it is an inclusive approach, whether it integrates local knowledge, and whether you've truly understood local context. Adding to that is the complexities of climate change and the fact that Indigenous communities disproportionately face climate change impacts more so than non-Indigenous communities. And lastly, I would say is we tend to have a conversation about let's find the appropriate technology, let's find the appropriate solution for Indigenous communities. And I would encourage conversation around a contextually relevant solution for those communities rather than what is deemed appropriate, because appropriate actually has rendered us to providing solutions that are easy to operate, that are, from a maintenance perspective, not cumbersome. And that's because we've biased ourselves and made a decision that communities can't handle a more complex system. When that's not the case. We just needed to think about training capacity and education at the outset. So what happens if you do that? What happens if you actually approach your water and wastewater treatment design process? And not everybody is able to do that, and not everybody should necessarily do that. This is a process that requires a lot of different people at the table. Well, when we incorporate Indigenous ways of knowing and doing in recognizing their rights, and we consider holistic and circular viewpoints, we actually foster stronger reconnection, empowerment, ownership. We're walking the path towards reconciliation with Indigenous people. We're increasing community participation. Really importantly, we're actually in many cases, and this is borne true in a few of the communities that I've worked with recently, you're reducing costs. And it's not just reducing capital costs, it's reducing long-term operations and maintenance. You're increasing the sustainability long-term because you've chosen something that's engaged the community in the process, and they're more on board and have a greater appetite to engage in that process long-term because they actually were invested in the decision at the outset. And lastly, I would say that we're repairing the damage of decades of what I would call bad engineering, where we have just gone in, made assumptions, provided what we thought was a solution and walked away. And we're fostering a rebuilding of trust towards a more collaborative approach to fixing this gap. So to end there, really is to say that while I'd love to be able to tell you exactly what technologies are going to solve this complex gap in providing safe, clean drinking water and adequate sanitation to Indigenous communities, the reality is that it's going to require an approach that really tackles some of these bigger issues. And if you think that that's not an engineering problem, I would also say that it is. We need people in decision-making powers in these types of roles that understand the complexity of the technology. What happens right now is most people talking and making policies and driving direction actually have no idea just how complex it is to provide clean, safe drinking water. And so that's why we need people that have the really strong technical backgrounds that can assert that in a different way outside of the typical consulting practice. So I'll leave it there. I apologize that we weren't able to see the full screen of the presentation, but I don't think that we lost anything in the conversation. So I'll leave it there so that we can have a little chat.